Okay, good afternoon or good morning to those of you on the West Coast, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host today. We've got a great webinar coming up in the next hour or so, and we're going to be hearing about work requirements in the safety net and the challenges of implementation. So let me welcome our distinguished presenters. Ron Haskins is a Senior Fellow and the Cabot Family Chair and the Co-Director of the Center on Children and Families at the Brookings Institution. And Diane Swonk is the Director of the Institute for Policy Research and the Margaret Walker Alexander Professor at Northwestern University. So it's such an honor to have both of you talking to us today. Thanks for being here.
Glad to do it.
Thanks for having us.
Wonderful. So I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any views expressed in today's webinar are those of the presenters alone and don't necessarily reflect any positions of ASPE or the Institute for Research on Poverty. As we get started, let me give you a quick outline of our webinar today. We have an hour, and our presenters will talk for each talk for around 15 minutes, and then following their main presentation, they'll both take a few minutes to kind of respond to each other's comments. I think it's fairly well known that our presenters may come at this issue from different perspectives, but we're not really structuring today's webinar as a debate, but more as a way to explore some of the nuts and bolts and trade-offs that are at play with the work requirements that are currently on the table at a lot of at the state and federal levels. So. Following their responses, we'll save the last 15 minutes or so for your questions today, so please feel free to type those into the Q&A box at the bottom of your screen throughout the webinar today, and we'll get to as many of those as we can before our time's up. And we are recording the webinar today and plan to have the recording and a copy of the slides posted on the IRP website by later this week. You can also look for the recording on IRP's YouTube channel. So with that, Ron and Diane, thanks so much for being here, and Ron, you'll be starting us off today, I believe.
Okay, good. Thank you very much. First, I want to acknowledge I'm glad to do this with Diane. She and I have done a number of things like this in the past, and I'm used to being humiliated and defeated in verbal discussion with her, and I have no doubt that that will occur today as well. Although I think over the years, especially on this issue of work and the issues surrounding work, our positions may have come somewhat closer together. We'll find that out during the discussion today. And let me just say, I think that this discussion has taken a more practical tone because there's lots of discussion in Washington about expanding work requirements. There's been a lot of dissatisfaction, especially among Republicans, about the work requirements in the TANF program, which were largely put into the program in the 1996 welfare reform legislation by Republicans. They have been suspended during as a result of the recession of 2008, and many states have not had them re-implemented. So the Republicans feel that the requirements were a little light, and they would like to change the requirements and make them stronger. There's been a lot of talk lately about work requirements in the Medicaid program, and indeed the Obama administration has created a possibility for states to actually implement work requirements in the Medicaid program under waivers. So there's not national requirements, there's not a national program that says Medicaid has to have a work requirement, and these are the specific requirements that people have to meet, as there are in both the TANF program and in the food stamp program. And there is a very slight requirement in the housing program. I'll talk about all those in just a minute. So let me begin by pointing out, and I think this is extremely important to keep in mind in all of our considerations of work requirements should take place in the face of the with consideration of the programs that we have in our law at both the federal and state level that support work. A major strategy that the U.S. has followed, and this has expanded greatly since the welfare reform legislation of 1996, is to create programs that provide additional money to people who work. And I believe Diane has done work, and others have done work to show that the expansion in these programs, which have been very considerable over the years, have resulted primarily in low-income working families doing better, and families that don't work either not doing better or actually doing worse. So these programs are the programs that do that. Let me just say a word about each of them. The Earned Income Tax Credit is undoubtedly the most important. It's over $70 billion a year. It's been expanded several times. I think it's fair to say that of all the programs in this area, EITC is the most bipartisan. Republicans, Democrats both support it. There have been very few moves to try to cut it back. So the EIT, and it's a very important program that gives money. But the families who only work, that's what makes Republicans like it. And it gives money to low-income families, which I think Republicans like as well, but that makes it very attractive to Democrats. Then child care would be impossible to describe in any brief presentation. I figure now we spend at least $37 billion a year on various child care programs, both those designed simply to provide child care and those provided to boost child development. And I don't think that there's a clear line between those two things. So we have many programs in play here, programs including Head Start, pre-K programs that are paid entirely at the state level. Those programs are both quite large, and although they are not designed to be child care, they do provide care to children during the day, and sometimes their mothers work while they're getting child care, and then the family has to worry about making arrangements because most of the programs are not full day. And then the child tax credit and additional child tax credit are tied to work because you get the programs are based on a subsidy to working families. That the child tax credit program was expanded during legislation. It's supposed to be last year, but actually this year. The legislation passed in March of this year. And the child tax credit was expanded in several ways, including the maximum amount was doubled from $1,000 to $2,000 per child. And families, especially those with multiple children, can get a lot of money from those programs. The SNAP program, although it doesn't, I've already said it has a work requirement, it was not designed and it has not been redesigned particularly to help low-income working families, but it still provides a benefit to millions of working families. It phases out pretty quickly as earnings increase, so it can be a work disincentive for a number of families, and it is a work disincentive for a number of families. The Medicaid program provides generous benefits to millions and millions of American families. It's very much in public debate now. It was expanded in many states under Obamacare. There are still a few states that have not expanded it, and families are not covered because they did not adopt the Obamacare option under Medicaid. The TANF program is probably the prime working program. I'll come back and talk in more detail about that in a minute. And then there are housing programs that also provide benefits to working families, although again, they phase out at a fairly low income level, so they certainly are not primarily known as a benefit for working families. But all of these programs can provide benefits to working families. If you look on a chart that tries to trace the phase-ins and phase-outs of all these programs, it looks like spaghetti on a map. It's not a logical arrangement. It doesn't make a lot of sense. It's very hard to decipher. It would be impossible for a family to figure out what the incentives and what the work incentives and disincentives are, especially because as your earnings change, then the way these benefits treat those earnings change. So I think it's a very disorganized system. I think we could do a lot of work to rationalize that system that would have the effect of increasing the motivation at work. This next chart looks complex, but it's simple for my purposes. Diane has a number of charts like this, and she can explain things a lot better than I can, but I just want to make a simple point from this chart. The gray shaded area on the right there shows that for recipients of Medicaid, SNAP, and housing, and these are figures for 2013. They're taken from a report from the Council of Economic Advisors that all of you can get access to. And the gray part on the right shows disabled and aged recipients of these programs. I don't think that anybody is seriously proposing new mandatory requirements for disabled or elderly citizens. There are a number of provisions that are intended to encourage work, especially by disabled. That works on a bipartisan basis. The Bipartisan Policy Center has had a working group on trying to encourage disabled people to work. It would not be a requirement, though. It's encouraging them to work because they, in many cases, they would be better off. But the discussion we're going to have today, at least my part of the discussion, I think Diane's too, does not apply to those people. So as you can see, roughly 40% of the people that we're thinking about in Medicaid, SNAP, and housing, it's a little bit higher in SNAP, are disabled or aged, and they're not a matter of discussion here. So now look at the bar graphs on the left of that gray shaded area in each of the three. And the one that I'm interested in is the dark blue. That shows the percentage of family or individuals in these programs who do not work. They have 0 hours of work. And as you can see, it's roughly speaking half. It's a little bit less in the housing programs. But there are a lot of people in these programs who don't work. If I read Diane's charts correctly, she's going to go into the reason for non-work. And we've had a lot of concern about non-work in recent years. The Census Bureau and the Bureau of Labor Statistics have both done analyses of why people don't work. There are lots of questions of people who don't work about why they don't work. And I think many people on the phone would be likely to think the reasons they give are reasonable. But still, there are many people, including, and I would say disproportionately Republicans, who think that work requirements should be stronger in these programs, and more of the people in that blue part of the bar graph should work. That's controversial. We have debates about that in Washington all the time. If the laws actually change so that there would be mandatory work requirements, I think there would be no question that there would be a very serious debate in Washington, and it would include even, a certain amount of invective. I want to say that a part of this debate is to try to have a rational consideration of if we had mandatory requirements for work, what should they look like? So before I go into that I can't go into great detail, but before I go into that, I want to just say a brief word about the current work requirements. And these are extremely abbreviated, especially the ones in TANF are very complex. So the TANF work requirements that half the single-parent families and 90% of the two-parent families. I think a lot of people recognized from the beginning that's not a reasonable requirement, but very few states have ever been able to reach 90%. But half of the single-parent families who are considered work eligible must meet a work requirement. Roughly speaking, that means they have to participate in one of 12 work activities. I've given you examples in this next chart about what the work activities are, and they have to average 30 hours a week with 20 hours for single parents with children under age 3. As I say, there are some complexities here, but that roughly gives you an idea that this is quite a substantial work requirement. States often fail to meet that requirement, and they are often penalized, and even more states do all kinds of tricky things that were not recognized in the original legislation in order to meet the work requirements. So to the extent that they meet the work requirement, they often do so by tricky measures that are not really permitted under the original legislation, but nonetheless are tolerated. Then there's the SNAP requirement that applies to able-bodied adults without any disabilities, without dependents. Those people on the SNAP rolls are limited to 3 months of benefits in a 36-month period unless they meet the work requirement. So on the face of it, that's a fairly stiff requirement. They have to work at least 80 hours a month. Or they can be enrolled in qualified education and training programs, so that it's not just work. It could be education and training, or they can qualify for a qualified workfare program or a approved SNAP education and training program. So there are a fair number of flexibilities here, and states can meet this requirement, help individuals meet the requirement with lots of mixture of work and education. And then finally, this minor requirement, Medicaid. This, remember, is not a program that is required. Not all people in Medicaid have to meet it. These are roughly the requirements that have been used in the states that have asked permission from the federal government to get a waiver so that they can have a work requirement in a Medicaid program. And roughly speaking, the work requirements are as they're described here. So it's 80 hours a month. It can include job and training. It can include people enrolled in education. So again, it's not just work. It includes education. And then the modest requirement in the housing program, 8 hours a month, and even this very modest requirement is often observed breach, and the Inspector General of Housing and Urban Development has pointed that out on a couple of occasions. Now, here is a list of the questions that I think we really should focus on if we want to help, if Congress wants to figure out a good work requirement for, I think, including TANF. You could reform the law and change the work requirement, but certainly for food stamps, for Medicaid, for housing, if we're going to have work requirements, here are the kind of questions we need to answer. Who's subject to the work requirement? What activities count toward work? And that especially applies to whether it has to be just work, or whether it can include education and training, which done properly can, and research shows this, can increase wages and perhaps increase the length of time people stay in the labor force. How many hours do recipients have to work to count toward fulfilling a requirement? Are there going to be sanctions against individuals, and how serious are they going to be? Will there be sanctions against states that fail to meet the work requirements? There are sanctions against both individuals and states in the TANF program. How is the funding handled? This is a very big issue. Are the states going to have enough money to provide both training and employment? So a lot of people argue that the money in TANF does not go far enough. The money is too tight. It's cheaper for the states to just put people in a work program and not pay for a training program. Some of the training programs can cost $5,000, $6,000, even more than that per year, and the states say they don't have the money to do that. Then the next question is evaluation. No matter what we do, we should have careful evaluation. We've had welfare reform now for 20 years. We've learned much less than we could have learned because we don't have appropriate evaluation requirements. And another part of that issue is who's going to pay for evaluation. I don't think we should expect the states to pay for it because they'll crimp, and I think we ought to have some arrangement that the federal government will help pay for the evaluations, and we need to ensure that there are high-quality evaluations. So those are the main questions that we're going to have to deal with in the near future if we're going to expand the work requirements and the employment and training requirements in all these programs. And as I say, let me emphasize this once again, there's no insurance that we will. We could go on like we are right now for many years, but I do think that we need to address the TANF program because it already exists, and I think it has some serious shortcomings that should be fixed.
Thank you, Ron. And Diane?
Thank you very much. So this is Diane Swonk, and I'm presenting an overview of a variety of research projects that I've been working on recently. And I want to extend thanks to my collaborations at the Hamilton Project, including Lauren Bauer, who I see is on the phone now, and Jay Shambaugh, Sandy Black, and others, and also my co-author, Kristen Butcher. And we will get to some of those results here in just a minute. So thanks to Ron for all of the kind things that he said. I agree wholeheartedly. Ron and I share common values here. We think that work is good for people and work is good for the economy, and we would like to encourage more people to work. I would say Ron and I also share a commitment to evidence and to reason, which is something that I appreciate today. I come at these types of questions as a labor economist, and that means that I want to understand how policies like this will also interact with the realities of the labor market, especially for workers with lower levels of skill, who are the people who are more likely to be impacted by these work requirements, proposed work requirements. So just to start, we absolutely have a work problem in the United States. Men's labor force participation rate, despite having ticked up very recently, has been falling, since 1950. It's also falling around the world, but it's falling quicker in the United States. Women, which is what I have on this graph that you can see, they've started to show a decline in their labor force participation around the year 2000, and that is grossly out of line with other countries. But what this graph shows is when we look at different types of women who've got more or less of an attachment to safety net programs that Ron was describing, what this shows is that over the last 20 years or so, the decline in women's labor force participation has been universal. It has not been concentrated among those eligible for safety net programs. To me, as a labor economist, that suggests that while we have a work problem, it is unlikely that the safety net is an important contributor to that. Second, I want to just, for background, to point out that our safety net programs are increasingly supporting work. So what this graph shows is that over time, spending on families with children, which is what I've analyzed here, has gone up by earning status. So people who have earnings are in in orange here. Those without earnings are in blue. And you can see across each of these programs, with the exception of AFTC TANF, which has declined in secular terms very dramatically, the orange part is going up over time. Much more of the spending is going to families that also have earnings. So against this backdrop, where there's a secular decline in employment participation among all sorts of groups of women, and we're seeing that the safety net is encouraging earnings more and more, here we are talking about increasing work requirements, potentially increasing work requirements. So again, as a labor economist, I've come to this trying to understand what the labor market looks like and how the realities of the labor market faced by workers with low levels of education will interact with these proposed safety net changes, the work requirements. So what you can see here on the graph is I've listed out some of the most common occupations among SNAP or Medicaid participants. And the top 10 occupations cover about a third of people who participate in those programs. So you can see, these are in, occupations such as nursing aides, cashiers, cooks, et cetera. I've done analysis, and you can see I've linked to the Center on Budget and Policy Priorities that it accesses this much more deeply. When we look at these occupations, they're characterized by things like low wages and stagnant wages that have not grown in years, high levels of unemployment, relatively unstable hours offered to workers. So we see that workers change their hours quite a bit in these occupations. There's more job displacement. And in fact, we find that when someone gets a job in one of these occupations, it doesn't seem to be an elevator to the middle class. In fact, they seem to bounce around in the same types of jobs, experiencing little wage growth and lots of instability of hours. So again, sort of with that as backdrop, we can think about what it would look like to have increased exposures to work requirements. So I've drawn this from some work that we recently did with the Hamilton Project, and I'm only going to concentrate on SNAP recipients today, but we also did the same type of analysis for Medicaid recipients. What you can see here is under the House proposal in the Farm Bill, many more people will be subject to work requirements. Currently, about 11% of SNAP recipients are exposed to work requirements. But another 22% of all participants would be newly exposed under the House bill, which is these two groups in purple. Increased exposure to work requirements will also have implications for the children in these households, the senior citizens, disabled members of these households. Just to note, a much larger share of Medicaid participants could be exposed to proposed work requirements here. So we're imagining expanding these pretty dramatically. The majority of SNAP participants who would be exposed to work requirements are already in the labor force, as shown in this next picture. So we find that it's useful to break up the people who would be exposed to work requirements into three different groups. The first are those between age 18 and 49 with no dependents, and those are currently not exposed to any work requirements, or sorry, they are currently exposed to work requirements, although this proposed bill would tighten up those requirements, and so in particular, you would not be allowed 3 months of non-work. You would have to work in every month or involved in an activity every month. Then we can move over to the right. We can think about those who are age 18 to 49 who have children at home between ages 6 and 17. This would be a group that's newly exposed. And of these younger, newly exposed SNAP participants, 86% were already in the labor force. But you can see, looking at these various colors, they have different types of attachment to the labor force. So of these, 46% would meet the work requirements consistently, but another important share, 28%, would pass the work requirements in some months, but fail in others. Why would they do that? Well, it's because their jobs hours fluctuate, or that they lose a job temporarily and then regain a job. There's fluctuations here that would make them ineligible for SNAP benefits under the proposed changes in some months. And then the third group are older workers, ages 50 to 59. They'd be newly exposed to work requirements. These folks are less likely to work than the younger group. 54% of them were in the labor force. So it's useful then to come through and think about why are some of these individuals not working. So we'll start with the younger group with children between ages 6 and 17 at home. So what this graph shows is a little more than a third are, sorry, I'm trying to move this arrow and it's not working anymore. Okay, there we go. A little more than a third are participating regularly in employment and are never asked, why are you not working? Among those who are not always working, when asked why are you not working in some month, over a third report that the reason that they're not working at least 20 hours is for a work-related reason. So they can't find a job, their hours have been cut, etc. Among the relatively modest share that are not in the labor force, about half of those that are out of the labor force cite health or disability reasons for not working. So among the younger group, the majority of those who would be sanctioned at some point would be sanctioned because they're not able to find adequate employment. If we then turn to the older workers, the pattern looks quite different. So now we can see that more than half of the older and newly exposed SNAP participants who are not in the labor force cite health or disability reasons for not being in the labor force. That is, 87% of those not in the labor force attribute their lack of work or to health or disability. A very small share, only 3%, cite retirement or lack of interest in working. So what does this mean? Well, it means that for those who are going to be trying to help these people get jobs, the older workers are going to have different barriers to work, health-related barriers to work, and those will be, I would argue, just quite difficult to overcome for these older workers. I will spend just a minute rebutting one of Ron's points, which I know would be the next thing, and so I'm going to just grab my time on that right now, which is one of the first pictures that Ron showed, looked at monthly snapshot of the share of people who are working or who are not working. But as we've learned about the low-skilled labor market, things are quite volatile. And so that means that looking at just one point in time is quite misleading. Many people who are out of the labor force in that month will rejoin the labor force in a couple of months, or will become employed again. So you can see over on the left-hand side, we can see the share of people who are not in the labor force is the gray line among SNAP recipients in 1 month compared to over a 2-year period. And you can see that over a 2-year period, many fewer are not in the labor force. Sorry, this on the left is the group overall. On the right is the group that participates in SNAP. A single month really overstates the share of people who are not in the labor force. So to conclude, my analysis suggests that the share of SNAP participants who are not working but could work and might work if threatened with the loss of benefits is relatively small, quite small in fact, particularly when compared to those who would be exposed to sanction under these proposed policies who are working or should be exempt from work requirements. But that's where I'll end it, and I can turn it back over to Ron.
Okay, thank you, Diane. And so now we're just going to give each presenter a few minutes to respond with anything they want to follow up with. So Ron, take it away.
Okay, here are a couple of quick points. First, Diane brought up lower levels of skills, and I mentioned that just briefly. That is deserving an entire program because that is one of our main problems, and we have not dealt with it adequately. Our overemphasis of 4-year college education is a big problem. I think there's now, there's not universal agreement. Boy, it's really widespread compared to where it was 5 or 10 years ago. So we need to develop programs that can help people with a high school degree, but not a 4-year degree, acquire skills and experience through apprenticeships and other programs that will allow them to greatly increase their income and make it possible to earn a living that will support a family. We have examples of programs that can do that, or at least it can be successful. I wish I had made the point more strongly, and that Diane, I think, needs to consider this as well, and that is, and I think she may agree with it, especially with the new benefits that I described at the beginning of my proposal. People just are not going to do well economically unless they work. We are never going to have a welfare system that provides people with benefits that will allow them to have even $40,000 or $45,000 a year unless they work. So the stakes here are not just some kind of, trying to punish people who don't work. It's that to do well in America, you have to work. So we have to have programs that help people work, and that in itself is not going to satisfy the problem, as we suggested. Both of us agree with this. We need subsidies, more training, and so forth that can boost both qualifications and the subsidies that will boost their income. So training is a huge part of this. This issue of long-term and short-term that Diane showed in her graph, there is a point there, and I wouldn't completely reject the point, but the people who are short-term, they go in and out, go in and out, go in and out. I think what that points to, part of what that points to, is a problem with the labor market itself, which is going to be very difficult to solve. So we're going to have to deal with people who are going in and out of the labor force. And I don't know whether requirements are the answer for them. Many of them go out of the labor force and go back on welfare programs, although that's getting, in some cases, increasingly hard to do. But this short-term, long-term problem is something we definitely need to deal with better than we have in the past. And finally, I want to make the point that all of my discussions and my entire outlook depends on us entering a period in which we experiment with work programs. We need to find out what works. We need to find out how we can supplement work with various benefit programs. We shouldn't. My problem with some of the requirements in the TANF program are that we just impose them without any serious evidence that they would work, and some of them we found out don't work very well. So we need to have much more experimental attitude. We need to do careful research. We need to develop programs that will actually help people both enter the labor force and have more total income, that's earnings plus benefits, than they have now.
Thanks, and then just a brief response to Ron. So it really does feel to me like the fundamental place where we're disagreeing here is that, I think we all agree that many SNAP participants and Medicaid recipients are working, and many of them are working in, I would say, respectable jobs: cashiers, cooks, sales clerks, janitors, nursing aides, et cetera. But the problem is with the labor market there, that they experience volatility in hours, in employment, low wages, lack of wage growth, et cetera. These policies to require monthly 20 hours per week of work, monthly 80 hours a week, will then punish the workers because of labor market dynamics. But currently, the proposals say that you lose benefit in any month where you're not working at least 80 hours. So I think what we see in the data is that the majority of SNAP participants who would be newly exposed to work requirements, they're actually already in the labor force, but a substantial share of them would fail to consistently meet that 20 hours per week work threshold because of the volatility in the low-wage labor market. The one exception to that is this group of older workers, and among those who are not in the labor force are overwhelmingly out of the labor force because of health or disability reasons. They're not on disability insurance, but the barriers to getting them back to work will be very strong. So what I'd like to see is move to a system where we're working along with the labor market and not, ignoring the realities of the labor market and punishing people who are trying to work, who are often working in the meantime. Thanks.
Okay, well, thanks to both of you. So we're going to start Q&A here, and I just want to remind we were always starting to get some questions in, so please do type those in, and we'll get to as many of those as we can before we start out today. So one of the first things that came in is just kind of an FYI, just that the Centers for Medicare and Medicaid Services just announced a Wisconsin waiver for community engagement that came up today, so you can look at that if you want to see more details there. But as a first question, and I think, Diane, you can start us off here and Ron can follow, we haven't talked much about administrative costs that come along with work requirements, and what are some of the things we should consider when we're thinking about that? So, Diane, do you want to start?
Sure. I agree that we need to be thinking much more about administrative costs, and imposing a monthly check-in requirement, potentially with documentation, will drive up the administrative costs, to be sure. I think we've seen places try to experiment with ways to reduce those costs, but I think they've been extremely unsuccessful so far. I was recently on a panel with someone from CMS in the state of Arkansas, where people have to log on to a website every month. The website is closed at certain points. There's just a lot of burden placed on the individual, a lot of additional cost on the state as well, but then there's a lot of errors that get induced by this extremely frequent interaction. And I just think it's another reason why the monthly check-in, in combination with the volatility in the labor market, just really opens the door for lots of errors and lots of costs.
Okay.
I agree that there are bound to be expenses in any administrative system, but we can't do without them, especially if we're going to try to develop sophisticated programs that try to help people who are going in and out of the labor force and keep track of the benefits they're qualified for and so forth. The states need to develop much better systems to do this. And to the extent that the state systems cause people even more difficulties, as under the examples Diane talks about. I don't know about those specific examples, but I'm aware of a number of cases in which the state data keeping system interfered with people's ability to work, and that we have to minimize as much as possible. But we have to have data keeping because we have to have evaluation. We have to know how effective these programs are, and therefore we have to keep track of hours and earnings and so forth. Without that, we'll never know what's going on.
Okay. I'd like to bridge off of that, and Ron, you both talked about evaluation a bit, but what sorts of things would you want to see in evaluation programs? What sort of things do you think would make it work, and what sort of evidence would you look for to show either that programs were working or not? And Ron, do you want to start us off there?
Yes. The most basic thing is that we want to know about employment, so duration of employment, and in and out of the labor force, and earnings. Those are the two most important outcomes, I think, and especially to learn those over the long term. That will be much more difficult because it requires longitudinal data. But states are in a position to do some studies like that. We have found out recently by getting access to IRS records that we learn a lot more if we can follow people's earnings over a period of years. So that's the first thing. I would want the states to develop data series that they can follow people's employment over a fairly long term, at least a year, 2, 3, 5 years, to find out what the effects of their programs are. Secondly, I'm a huge fan of random assignment studies, and I think we ought to use random assignment when we can, but I cannot imagine that all the things that we'd like to learn, and especially following what happens in the states, that we're only going to accept random assignment studies. If we had good descriptive data of what happens to people who enter programs, I think that would be a useful addition to what we know now. It wouldn't be definitive, nearly as definitive as random assignment, but I think it would be very useful and much better than not having data at all. So we need to minimize the expenses of these programs. And then one of the most important points is the federal government has got to help by subsidizing the research. If we don't do the research, we don't learn more about what programs work and how long the effects last, it's going to be a waste of effort.
Okay. Diane?
Yeah, I agree with that, and I would just add that it's really important that we keep that counterfactual in mind. And so, we see that so many of particularly the SNAP participants are already working. They're working in jobs like cashiers and cooks and sales clerks. And so we want to know, how much better, what sort of new jobs can they get after these educational investments, and, what is the impact on earnings, on hours, et cetera.
Okay. So that kind of follows into our next question here. We have a questioner that's interested in your suggestions for thinking about, a lot of people that are working and working quite a bit are still, around the poverty level or below that. And, if upskilling the labor force is a strategy, is there concern that, that this could have effects on certain labor pools that, may not really that are important? And Ron, do you want to start us off there?
I don't completely understand the question, I don't think, but there's no question that there are large portions of the labor market, especially for families with children, that will be difficult for them to get above the poverty level. But that's where we are now. If, to the extent that people can acquire skills and experience in jobs that do not require a 4-year degree, they can do better. We have a number of studies that show this. And we have studies that show that we can train people to do a better job to be more effective in those kinds of jobs. Many of them would get out of poverty. Some of them would not get out of poverty, but many of those people are already in poverty. So the real issue here, again, we're back to a research issue, and having some counterfactual is to compare the poverty rates in a group of people that participated in the program and a group of people that didn't participate in the program. But we have a number of these programs that can reduce poverty rates. No program is going to completely reduce end poverty in the group that gets the program, but they could reduce the poverty rate, and as I say, we already have studies to show that. So that's an improvement.
Diane, did you have anything you wanted to add?
Yeah, I mean, I would just add to that, to be sure, we need nursing aides and orderlies and attendants, right? Which is the group that is sort of the most common occupation among SNAP recipients. And I don't think that we're in a world where we think that we want to take all of those people and train them to do something different. So if it's the case that, maybe because of the family size or other reasons, people in those jobs can't make a wage that lifts them out of poverty, that they still need help from the safety net, I think that is, I think that that's fine, and that's functioned pretty well for us in the past. And so I agree, of course, we always want to have people with increasing levels of skills, but much of the debate right now is about punishing people who currently have jobs, that are are volatile. And that is sort of my bottom line, is that we need to keep in mind that these types of work requirements, especially the ones that are proposed in the House Farm Bill, will punish a lot of people who are hardworking.
Okay.
Well, again, I think this illustrates one of the points that I was trying to make about our lack of knowledge. We have millions of people in the food stamp program now who are subject to the work requirement. We should have been doing research. We've had requirements since 1996, and we should know more about if those people really are worse off because they're subject to a work requirement, especially when we compare those people to the other people on TANF who are subject to a requirement and avoid it in some way. That's the kind of thing we need to know. We need to know what the balance is between the people who are helped and the people who aren't. If there is if Diane is right and there's a large group of people who are hurt by these requirements, then we ought to modify the requirements. I think part of the problem here is a lack of data to let us design good requirements. The kind of program that I'm thinking about for education between a high school degree and a 4-year college degree would depend almost entirely on people volunteering. So they're controlling their own life. We're making it possible for them to get additional education in many cases while they work. If they're young, they can get that during the years that other people their age are in college, and they can go to programs like the Kentucky FAME program that's spread around the state of Kentucky, and there are a number of other programs like that around the country where people who are 18, 20, 22 years old who participate, they actually earn money while they're working and getting experience and also getting training. And when they finish the program and they're certified and get the kind of certifications that will help them get jobs and qualify for higher wages, almost all of them graduate debt-free, which is a huge improvement over where we are currently. And that's all. They decide what they want to do. The system ought to be based, to the extent possible, on people deciding themselves what they want to do. If we have people who have long history of non-work, as the group that we talked about, males, and Diane says they're older, and I think they are disproportionately older, but some of them are younger too, and they're sitting in a basement somewhere playing video games. Those are the kind of people that we really need to attract into the workforce and make it worthwhile for them to see that if they work and prepare, they can do much better than they're doing now.
And I just want a quick follow-up on that those young men who are in their parents' basement playing video games are already subject to work requirements and SNAP. We're talking about expanding this to mothers, or people with children, and to older workers. And those are much more difficult nuts to crack, I think.
Okay. Ron, you talked a little bit about designing better work requirements. And I think possibly one of the things that might be included in that is thinking about cliffs. So what happens when people fall below that level? So I guess I'm curious on what both of your thoughts are on, in terms of, like what happens when people fall below those cliffs and what could be done to make these, possibly less punitive, something like that. So, Diane, do you want to start us off with this one?
Sure. So just to start, I think that the monthly requirement of, in any month that you dip below 80 hours per month, 20 hours a week, you lose your benefits. That's something that would be relatively straightforward to smooth over. And so, that's in fact a pretty big change from the work requirements that are already there, which at least allow 3 months, which still isn't that much of access to benefits. So that's one is really the the monthly check-in. I think is one of the first that if I were trying to design a better work requirement, that's something I would tackle. But at the end of the day, any of these work requirements will be very hard to implement in a reasonable way because of the volatility of the labor market that I've described, and also because of the large number of older Americans who are nearing retirement age who have dropped out of the labor force. It's going to be, it's just basically impossible to think about constructing a work requirement scheme that will be that will provide incentives for them, given all the barriers that they're facing.
Ron?
I think most of what she says is true, but I think we can design a system that would focus on the younger people. I personally, if someone is 60, 55, I'm less concerned about them than I am someone who's 25 or 30. And I would want to focus our evaluation and our data keeping and figuring out the incentives on the younger group. And especially if it turns out, as Diane says, that they're punished. And the ones who are working but not enough hours to avoid an additional requirement, and they're hurt by these requirements, then I think we have to modify them. But I think we need to figure out exactly what's happening first, and I don't think we know enough to know what actually is happening.
Okay. So we have a question mostly directed at Diane, talking about this older group who may not be working because of health reasons, things like that. Is there? Do you have a sense of what the interactions between work requirements and disability programs and other things like that might look like, and how easy of a time maybe some of these folks have accessing disability exemptions?
Sure. So I think the question is particularly about there are assumptions baked into, let's say, the CBO's scoring of the House bill that suggests that the expectation would be that many people will be exempted from these work requirements. And so that analysis that we've done that assumes that every time someone falls below 20 hours a week, they'll be sanctioned. Even though that's in the law, they say, well, we think that in implementation there will be lots of opportunities to provide exemptions here. I just think we have no idea what the exemptions are going to look like on the ground under this. And so, certainly states, and offices will need to think through, under what circumstances do we offer these types of exemptions? Will they have enough of an understanding of the labor market that the person faces? Do we think that they'll have a better sense of, this person really is trying, or this person really has, severe barriers to work that can't be, that work requirement won't be able to help. Like, all of those things will have to be worked out, but I just can't say with, in good conscience that we have a good sense of, that will be done perfectly or well, or, I still am gravely concerned that many people who are either just functionally incapable of working or are trying to work but are the victim of this volatility will be punished under this program.
Okay. Ron, did you have anything you wanted to add to
Hey,
that?
let me add one thing to this. We haven't emphasized this enough. A lot of these problems, if they're to be worked out, especially the tough ones like the ones Diane just talked about, the people who, she used the term, I think she said, functionally incapable of working, and I have no doubt there are people like that. They are going to be solved at the state and local level. I don't think you can design a policy from Washington that will provide a detailed set of requirements that handle all these problems. We have to give flexibility to the states. They have to develop themselves. And that's another reason why the evaluation is so important. We have to know what's working and what doesn't work. Because we do have a problem with non-work. And it has increased over the last 3 or 4 decades. And it's something that we should address. And there are many Americans who know that. I mean, that talk about, their neighbors that don't work and take advantage of public programs. So this is spreading, and it's demoralizing to people who have worked hard all their life, and they don't want to see other Americans who can live on benefits. And we should do something about it. And the states will be the state and local government will be the major players in developing programs that will do that.
Okay. So we are just about out of time for today, but I want to give each of you an opportunity to kind of provide us kind of a wrap-up thought, things that we should be looking towards for future policies, things that you'd like to see more research on specifically. We've talked about that a lot already, but so Ron, why don't you kick us off here, okay?
Okay, the first thing is I think we do need programs that try to find these people on Medicaid, on food stamps, even in housing, and especially TANF, who are not working enough, and we should help them work more, and to the extent that requires that we have to have requirements to do that, I think we should do it. I think especially in the programs where we haven't done this at all aggressively in the past, we ought to go slowly, because we don't want to have a bunch of requirements that kind of Diane is concerned about that are going to hurt people who work now. So we need to proceed slowly, but we need to evaluate, and we need to develop a set of rules and requirements that are true to each of these programs that will increase work levels, and that will make people better off, even if they're working at low wages, because of all the other benefits that I talked about before. The second thing is that, especially for younger people, we need to focus much more on education of the kind that it helps people who graduate from high school but do not have a 4-year degree. And no matter how hard we try and how much we're willing to spend, we are not going to be able to hugely increase the rate of 4-year degrees among this group of people. And we're going to leave a lot of them worse off because they're going to wind up with a debt. So we need to develop these additional programs, and I mentioned several specific types, and that will help a large group of these people. And over time, once they get in the labor force and they develop in the labor force, they'll continue to do better, and that will gradually build over the years, and I think that will fairly substantially reduce our problems. And finally, I just want to emphasize something that Diane and I have both said, and that is we need to evaluate and figure out what's working and what isn't, and try to expand what works.
Okay. And Diane?
Yeah, I agree with Ron's sentiment on that. I agree that education and training are extremely important to, especially for younger workers, to help ensure wage growth and, eventually self-sufficiency. But I do think that we've seen in the early results from states that have implemented work requirements for Medicaid, and from our analysis of what's likely to happen under SNAP, that rigid work requirements that don't take into consideration the fluctuations in the labor market or the particular circumstances of especially older workers who are out of the labor market are really going to end up punishing more people and not getting us toward the goals that we all share, which is, more work, more self-sufficiency. We've seen real successes in the changes that we've had in the social safety net over the last 20 years, as I showed, starting out. We've seen more money is going to families that are working, but for many of those families, earnings alone are not enough to lift them out of the reach of the social safety net. The Earned Income Tax Credit has done phenomenal work in lifting people out of poverty. We've seen that more and more SNAP participants are combining SNAP with work. The social safety net is supposed to be working, in conjunction with people's, own efforts, and currently it's by and large arranged in a way that that it acts as insurance, that it works alongside the economy and the labor market. And my grave concern is that these policies that are being proposed at the federal level and enacted at various states are really working at cross purposes and are going to make things much worse.
Okay. I just want to thank both of you so much for doing these presentations today and for being with us. So I thought this was really helpful and really informative, and so I just appreciate your time. So thanks so much.